The situation has been deteriorating here in Belgium for the past few weeks. The situation with intensive care units is there's 800 people there. There's over 500 new admissions to hospitals per day, around 48 people dying per day. And with that, it reflects on the situation in the public sector. When it comes to schools, there are less teachers able to go in. And similarly, then, when you look at the hospital situation where frontline staff are immediately confronted with the virus, of course, they're catching the virus. And as you mentioned there in Liège, some hospital staff who are asymptomatic and able to work physically are being asked to do so. Otherwise, the hospital system will collapse without the staff. Belgium does traditionally have quite a strong health system. But if you don't have the staff to man the ICU units or the other units in the hospital that don't relate to COVID, then the system is at a possibility of being overwhelmed. And of course, as you mentioned there, the idea that you would send a COVID positive staff member into any environment, let alone a hospital, means the situation is quite drastic.
Shona, at the same time, Belgian authorities have been asking their neighbouring countries for help. But who's able to do that? And what about this much vaunted European solidarity? Where does that figure?
Well, I mean, of course that exists, but the problem is that Belgium is not the only member state. It's probably all countries in the EU are suffering quite badly with COVID. Belgium is one of the worst. It's the second worst outside the Czech Republic, but other member states' hospitals are filling up as well. At the moment, the Belgian hospitals have been asking the Netherlands to take patients, and of course they said they will where possible, but similarly they have their own citizens to look after. And we saw this is really just almost the same as that we saw in March and April when hospitals were being built up all around Europe. And of course solidarity exists, but those governments and those hospitals in member states are going to try to prioritise their own citizens first.